The missing piece in addiction treatment no one talks about. Hello. I am Dr. K. Paul Stoller, a lifetime fellow of the American College of Hyperbaric Medicine, and I have a webinar on ending addictions at KENNETHSTOLLERMD.com now. Addiction is usually framed as a failure of will, a psychological problem, a behavioral disorder. But what if that's incomplete? What if addiction is also a problem of oxygen? When the body is poisoned by alcohol, narcotics, or toxins, it doesn't just affect behavior. It disrupts something deeper: cellular respiration, energy production, oxygen delivery. The brain becomes dysregulated. The nervous system destabilizes. What we call withdrawal is, in part, a body struggling to recover from metabolic suffocation. In 2005, I published a paper in the journal Pediatrics showing one could reverse fetal alcohol syndrome using hyperbaric oxygen therapy. I am not the only one who has discovered hyperbaric oxygen is important in addiction therapy. In a clinical study of over 300 patients, alcoholism, opioid addiction, toxic exposure, researchers introduced something unconventional: hyperbaric oxygen therapy. And what they observed was difficult to ignore. During treatment, patients didn't just stabilize, they shifted. Some experienced a calming, tranquilizing effect. Others felt a surge of energy, as if something inside them had been restored. But more importantly, the objective markers changed. Neurological symptoms improved faster. Autonomic instability settled down. Cardiovascular function normalized. And the most striking outcome? Treatment time was cut nearly in half. Why would oxygen do this? Because addiction isn't just chemical, it's hypoxic. Cells deprived of oxygen cannot regulate themselves. Detoxification slows. Energy collapses. The brain compensates in dysfunctional ways. Hyperbaric oxygen does three things. It floods tissues with oxygen. It accelerates detoxification. And it restores cellular energy production. In simple terms, it gives the body what it needs to heal faster. In my webinar on ending addictions, I address how hyperbaric oxygen is important in post-addiction recovery. Current addiction treatment has been missing something fundamental. Not just counseling, not just medication, but physiology. Because you cannot expect a brain to behave normally when it is operating in an oxygen deficit. Existing treatments for addictions don't work, which is why I have a protocol detailed in my webinar that does work, but hyperbaric oxygen is important in restoring normal function out of poisoned brain. Because sometimes the difference between dysfunction and recovery isn't willpower, it's biology. And sometimes it's as simple as oxygen. KENNETHSTOLLERMD.com.